So here's a preview of the ATI review that we're going to be posting tomorrow. I wanted just to give you a little bit of a flavor of what the ATI book is guiding you towards as you're getting ready to study. Now, I know that you have your final exam in pharmacology tomorrow, so many of you may be dissecting the two experiences and not studying for ATI until after the exam, which is perfectly fine. But in case you are studying today, I wanted to just give you a little bit of a heads up to what the ATI book is providing you with. And so as you look at each chapter in ATI, I'd like you to go to those, read it through in general, looking at the nursing interventions and the things that are unique for each medication that's within the chapter itself. When you get to the end, there are the questions that are specific for some of the nursing interventions, patient education, and distinct need-to-know items about each drug. Look at that very clearly, as well as do your practice exams often. And so I'm going to give you an example really quick now, as I'm looking at phenytoin, which is an anti-epileptical drug. It's a seizure drug, right? And so as we're looking at phenytoin, some of the things we need to think about with this drug, classic for phenytoin, is gingival hyperplasia, or an overgrowth or softening of the gum tissue. If we see this, we know that there's something that's awry with taking this medication, and we need to teach the patient about good oral care. But as a practitioner, I'm going to think about what are the phenytoin levels in this patient, because the therapeutic range is very narrow, and many times phenytoin can be at a toxic level, and we need to decrease that in our patient. And so as you're looking at phenytoin, now I'm going to give you the name brand, which is Dilantin. That might be a little more familiar to you. But when you're in the hospital, you're going to be seeing the generic names. So phenytoin is the name you need to think about. Also with phenytoin is there are CNS effects that can be there. Now remember, when you hear CNS effects, we start thinking safety, right? You can have ataxia, double vision, cognitive impairment. And so all those types of things, we want to make sure that this patient is safe. And other things that we're talking about with these patients is we're going to avoid use in pregnancy because it can be teratogenic. And going down a little bit further within the ATI book, I have it open on my screen here as well, is as you're looking at this drug, phenytoin can decrease the effectiveness of warfarin. And so warfarin, which is our drug that we use a lot for patients who are in AFib, to decrease platelet aggregation in order, or decrease bleeding time actually, in order to prevent blood clots. So warfarin is used there. Now remember, brand name for that is Coumadin, but as nurses and professionals we use the name warfarin. And so we will need to keep in mind that this does interact with warfarin. It also interacts with birth control pills. And so we are going to make sure that our patient knows that their birth control, if they're using a birth control pill, they might need to use an alternate form of birth control while they're on this drug. They're going to avoid alcohol, as well as we're going to watch those levels really closely. Now remember, the number one goal to an anti-seizure or an anti-epileptic medication is lack of seizures. We want to make sure that they're getting therapeutic control, so we need to teach these patients about their seizure treatment so that they can monitor its effectiveness. We're going to encourage them to avoid, to be safe, remember, so driving, operating heavy machinery until their seizures are controlled and they know the side effects of these drugs. And so we want to make sure that they're safe and taking this drug appropriately and there's no interactions. So that's one drug, and that's an example of one way we're going to be looking at some of the greatest hits for ATI as you go forward. Tomorrow I'll be recording a video in my office. I'm at home now. We'll be doing a video in my office that I'll be posting, and I'll do it in segments so that you'll have maybe 20-minute increments that you can look at, as well as you can't tolerate listening to me for more than 20 minutes. So we'll do that as well, and you can target being prepared for your pharmacology exam. If you have not downloaded the copy from ATI, do it now, because it really is very, very directive to guiding your studies. And it has very clearly identified the greatest hits of pharmacology. So I'll talk you through that verbally tomorrow, but until then, I want you to think about this Sunday as a day that you should be drinking plenty of water, eating healthy, go out and take a walk or get some movement, because your backside gets tired after sitting and studying for so long. And believe in yourself, because you've worked really hard to get this far. So as you go forward, take those things and remember you are your best asset. So your studies, and as you approach your finals week, know that we are supporting you, and you'll be looking forward to having a lovely second edition of a YouTube video from me. But know that I'm available to you via email if you have questions about your content. Either myself or Dr. Coletti are available to you. So God's blessings to you this Sunday, and I will look forward to speaking at you from this screen again tomorrow or whatever day you choose to watch it if you do.